Right, so as I mentioned, Caribou Biosciences has a pipeline of allogeneic CAR T cells as well as allogeneic natural killer cells, or CAR NK cells. And so in our pipeline, we have our first program, which is in the clinic today, and that addresses lymphoma. And so it targets CD19, and it uses an approach where we address persistence of anti-tumor activity. And there we knock out a checkpoint called PD-1 in those cells. And that, again, is unique in the field. We believe we're the only ones that are addressing a knockout of PD-1 in an allogeneic setting. And what we've shown preclinically is that that provides deeper debulking of a tumor in a preclinical setting compared to if we didn't knock out PD-1. And we think that that's going to lead to longer-term durability in the clinic, and we hope to see that later this year. So today we're presenting on CB11, and another program we have called CB12 addresses AML. And this is targeting a protein called CD371 that is exquisitely expressed on AML tumor cells, leukemic stem cells, but is not present on hematopoietic stem cells, which is important because as a patient is infused with these types of allogeneic CAR T cells, you don't want to wipe out their bone marrow hematopoietic stem cells that they couldn't then recover in order to fight infections and future cancers. And so the hope is that this would be a therapy that would be the only one required for their AML and not lead as a bridge to transplant. So if transplant could be required if these cells were attacking their hematopoietic stem cells. In these cells, we're thinking about different approaches for persistence. So we have the one in the clinic where we're addressing persistence of anti-tumor activity. And then we have the one we're presenting today in the poster, which addresses persistence in circulation. And so we're thinking of combining those approaches as well as other strategies to promote persistence of these allogeneic cells that will ultimately be rejected by the patient. I think just that this is really exciting for Caribou to be presenting these preclinical data at AACR, and these are data that we believe will differentiate this program in the field. There are many CAR T cell programs addressing multiple myeloma, and we think that addressing the patient population that may not be able to provide their own cells in the autologous setting, this provides an excellent niche for that. And also that we're addressing persistence, which I think is going to be key for long-term durability of these cells in patient populations.